Hi, Megan. I'm Kim. I'm your mental health nurse. I know you're being discharged soon, and I just wanted to talk about a bit what happened and kind of wanted to ask about how you're feeling and what are your plans for when you get discharged.
Life's just hard, like not having a house. It's kind of tough on someone, not knowing where to go, and especially not having the social support. Like it's not like I can call someone up and they're willing to help.
So you're finding it a little stressful that you don't have any concrete support systems set up.
And I guess that's kind of what happened for my abuse. That's why I started abusing drugs, probably.
So you started abusing drugs due to a lack of support?
Yeah, and not having a house kind of made it hard, and just the influence of everyone out there. A lot of them do drugs, and they kind of influence you to do it. It's hard.
Can you tell me a bit more about that? What do you mean?
Well, they're just doing it, and they ask you to do it, and then if you don't, they just judge you. But should I really worry about that? Probably not, but it's hard not to do it, because what else am I going to do out there?
So you're feeling kind of in a bind between fitting in and between what maybe you know you should be doing?
Yeah, you could say that.
Oh, that must be difficult.
It is pretty hard. It's not fun. Like, I wish I could become stable and have a house and have a job and have a family someday, maybe. But it's hard to get out of it once you're homeless. It's kind of hard to get your life all straightened out and back on the right track.
So I'm hearing that you have these goals, these ambitions, but that you're not really sure how to get there.
Right, and especially the social support again, like how on my own I find it kind of hard.
So do you have any resources in your community that you know of for when you'll be discharged? Do you have, are you going to be followed by a counselor or anything? I know that's still kind of up in the air. Are you open to that?
Yeah, I think that'd be great because they could help me maybe get the goals I want in life and stop using drugs completely. That's possible. I mean, it's going to be hard, but I think I want to do it.
That's great. So I'm hearing that you're really dedicated to turning your life around.
After dying, almost dying, I guess, it kind of opened my eyes a little bit to what I really want in life.
So you're saying that was your overdose that, brought you in ICU was kind of a life-changing experience?
It was. It really was to me. It made me think about what I want in life.
I'm happy to hear that. That's great.
It is nice. So just getting those goals will be a challenge for me now. But I think I'm up to it.
That's so nice. So what do you think, what is your main thing you want to tackle when you leave the hospital? What's your plan? How are you going to get your medications that you need now?
Yeah, that's going to be kind of hard. I don't know if I can afford it since I don't have an income, so it's going to be hard to stay on medications. So I don't know what I'll do about that.
Well, maybe we can see if we can set you up with the mobile crisis unit. I don't know if you know what they are.
No, I don't.
So they're a group of social workers, and they kind of do outreach in the community, and you can give them a call, and sometimes they can meet up with you to kind of discuss what's going on, and they're really good to help you sometimes get a counselor or get contacts, maybe hook you up with NB housing. That'd be
good, especially since I don't have anyone to really call that will listen to me. So it would be nice to have someone that would. And to get a house, to get somewhere to live, that'd be just great. Not have to. It's pretty cold out there some nights on the street.
Yeah. So I'm happy to hear you say that, you're very willing and motivated to.
Well, at first, if you would have talked to me maybe 2 years ago, then maybe I wouldn't have been as willing. But I mean, going through everything, it's not easy. So if someone's willing to help me, it makes it a little easier and try to get my goals in life.
Yeah.
It'd just be nice.
So having a social support system would be a great aid for you?
I think it would really help. Because without it, it's hard. It's so hard. I know I've said that so much, but.
And what do you foresee being one of your greatest challenges once you leave the hospital this week? Is it the temptation, or do you think it's maybe motivation?
That's going to be pretty hard too, especially seeing everyone. So if I get away from being homeless, but I mean that's going to take a while to do. So I'm hoping I won't. But you never know. I mean, it's tough.
So you're saying that you have the best intentions, but that you realize that temptation is there. And
yeah, and I really don't want to do it, and like, I might be a failure if I do, but I mean,
so you feel as if you're feeling that if you go back to drugs, you failed.
just a little bit. Especially setting out all my goals, so then if I told them that, and then they heard that I abused drugs again, I feel like they'd judge me and they wouldn't be willing to help me.
That sounds like quite a dilemma, kind of stuck between a hard spot and a rock a little bit.
Yeah, it kind of is. So I'm just hoping that I won't abuse, but it might.
Yeah, but you're young and there's always room for change, right? Good. Well, thanks for chatting. I'll go see your doctor and we'll talk about it again.